Greetings and welcome to our weekly educational round here at Sinclair. My name is Jim Ellermeyer. I'm a behavioral health therapist, and today I'm joined by two of my fine colleagues. On my left would be...
My name is Loren, and I'm a PA student from the University of Mount Union.
And on my right...
I'm Elise. I'm a PA student from Marietta College.
And here at Sinclair, as most folks probably know by now, we're an integrative holistic psychiatric facility where we do not treat diagnoses, we treat people. And in taking that holistic approach, we look at the enhancements that we can make to a person's mind, body, and spirit. And quite often, one of the things about a person's life, and how often do people spend sleeping their life? What part of their life do they spend sleeping?
One third of their life.
1/3 of their life.
Yes.
You spend 1/3 of your life sleeping. And when people sleep, quite often, what do they do, Sophia?
When they're sleeping, they often dream.
They often dream. So 1/3 of your life may be spent dreaming.
I don't know if it's that much.
and quite often, that's a subject that's quite often overlooked, isn't it?
It is.
Does anyone ever talk to you about your dreams?
No?
Elise?
Sometimes I tell people about what I dreamed. If I had like a really weird dream or something.
Uh-huh.
Yeah.
Uh-huh. Well, one of the things that we do, there's a couple ways to look at dreams. One is the neuroscience way, which we try to get all the bells and whistles down, what part of the brain, how it works, what chemicals are activated. And then there's the psychoanalytic part where we look at dreams as part of it. And Freud viewed dreams as the window into the subconscious. So what can you tell me about dreams, Sophia?
Well, dreams occur during our stage 5 REM sleep, and interpretation of dreams date back all the way to 3000, 4000 BC, where they were documented on clay tablets. A lot of primordial societies basically were thinking that your dreams were extensions of reality to a more powerful world. And other cultures believe that dreams can do something like forewarn or predict the future. So dreams from culture to culture change every aspect. And it's really interesting because not a lot of people know where they came from or how they came to be. So.
Yeah, absolutely. And talking about dreams has been around since the written word. In the Christian Bible, perhaps you might recall the passage where Jacob is in Egypt and he interprets the Pharaoh's dream and rises to a high part in the court.
Sure.
Mm-hmm. Well, you're handling that very nicely. And so let's talk a little bit about dreams. Let's talk a little bit about them. First of all, I'd like to get your thoughts on dream interpretation and dreams in the therapeutic sense, in a therapeutic setting.
Well, I think dream interpretations can go in a lot of different directions, depending on what you're looking for. If you can go to many different types of interpreters to see if you're seeking answers about why you're dreaming about different things. A lot of times they can come back to everyday things that are happening in your life, and sometimes they can provide a lot of conclusions to people as to how they're feeling and what type of feelings that they're harvesting as far as anxiety or anger towards other things. So they can provide feedback there, but I'm not sure that dreams should be dwelled on or meanings of them, just because I think people, I don't want you to get over excited about the meaning behind things. If you look into it too much, I think people can go a little overboard. But
well, certainly they're one part of the therapeutic puzzle.
Exactly.
Absolutely. You mentioned earlier that you had where you tell people when you have a weird dream.
Yeah.
What would you call a weird dream?
Just when like crazy things happen to you that wouldn't happen in real life. I don't know, I always have a dream where I'm driving and I like can't see anything and I don't pull over. I just keep driving, waiting to go off the road. And I don't, that's just one of the dreams I remember, and I would think that's weird because in real life, I would hope I would be able to see where I'm driving.
Okay.
And if I couldn't see, I would stop driving.
Okay, so in our waking life, our thoughts are more or less structured. Okay?
Yes.
We have some type of definite rules, Sophia, where our thoughts and we identify and we attempt to label them.
Right.
Okay? However, Elise, is when we dream, there are no rules. There are no rule books. So what is the standard that we interpret these dreams to? What is the standard? It would be our waking thoughts. So compared to our waking thoughts, these dreams may seem weird.
Yes.
Oh, okay. So quite often in our unstructured dreaming, we experience things that sometimes there's lag dreams, okay, where we may not bring up something in our subconscious in our dreams that occurred a week ago, okay, and then there's dreams that occur today. That when we process daily things. So we were mentioning lucid dreams before. Could you talk a little bit about that?
Lucid dreaming is when you kind of become aware that you're dreaming while you're dreaming. So I've heard people that can do this can kind of like control where the dream goes, and they have control over what they do in the dream.
Have you ever been dreaming and know you're dreaming?
At times.
And what type of experience is that?
It's kind of a scary feeling because it's like not real, but you can kind of control where it's going, and then you wake up and the dream tends to be a little more vivid because you're half awake.
Absolutely.
Partially.
So do we remember our dreams?
Not all of them. I think 95% of them we forget.
Let's talk about something that most people recognize and most people talk about, and that's nightmares, or what we would call bad dreams.
Yeah.
What can you tell us about that?
Yeah. It's very normal for people to have to remember bad dreams a little bit more often than good dreams. Negative emotions tend to occur twice as often as pleasant feelings. Fear and anxiety are the most commonly expressed emotions in dreams, followed by anger and sadness. So a lot of times you have nightmares, and children tend to have nightmares a lot more frequently than adults as well.
Absolutely. Why would you think that children would have nightmares more than adults, Elise?
Well,
any thoughts?
They're smaller. They kind of view the world as like a big place, a big scary place. They don't have as much experience as someone who's older. So
absolutely, and when children are small, they're interpreting in their dreams. They're going through their day and they're viewing what they have in their life. And actually, nightmares can be a learning experience for a child when they process through the day, and especially having parents who can understand those nightmares and tell them that they're not real, forget about it. They should be listened to and help the child interpret it. So what are we looking at? We're looking at, what we do is, Lisa, we look at themed dreams. We look at repeated type of dreams where there's not exactly scripted, but a scenario. Quite often here at Sinclair, we deal with people that have experienced some pretty horrific sexual, physical, and or emotional abuse, and quite often these secrets that are repressed, and quite often these dreams, these nightmares, these bad dreams are repressed thoughts or repressed feelings or repressed memories that in an unstructured world of dreaming they come out. Okay, and even then the brain is trying to protect the individual from trauma. Okay, so they place them in these repeated theme type of dreams, and particularly in sexual abuse, what you're looking for is theme dreams. Is it always dark? Are they always in the same place? Are they? Sometimes these things occur in the dark. Sometimes they occur in the same room, in the same house, and sometimes the house can be endless. And quite often, some of the things that people dream about the most, they dream about studying, they dream about sleeping, they dream about being pursued. They dream about falling. Those are 1, 2, and 3. 1, 2, and 3, and being afraid. So, if you're dealing with somebody, have you ever asked somebody about their dreams?
Yeah.
Okay, talk to me about that.
Yeah, you can ask somebody about what types of dreams they're having, and if they're pleasant or unpleasant. And most of the time, if they involve repeated dreams, I was reading up, it even said online that you can have repeated dreams from triggers, different things that are happening in your life that can cause you to have the same dream over again.
Absolutely, and when we're in our dreams, we're processing. We're processing life events. Again, remember, we're in an unstructured atmosphere where there are no rules. There is no rule book. There isn't even a thought of a rule book. So, which is why most people interpret their dreams as weird.
Yeah.
Okay. when actually they are not. So, repeated type of dreams. Could you tell us when we dream? Could you tell us when we dream?
Yeah. So, we tend to dream during our stage 5 REM sleep, and basically our sleep cycles is about 90 minutes, and for stage 1 we prepare to drift off into sleep, and then stage 2 lasts for about 20 minutes where we're getting a little bit more deeper into our sleep cycle, and then stage 3 we tend to be in a deep sleep, and then stage 4 is like one of the most deeper parts of sleep where we can do things like sleepwalk, and then or bedwetting tends to happen during that sleep. And then we go into stage 5, which is our REM sleep. And during this stage, we're actually paralyzed. That way we can't act out our dreams, which is probably a good thing for most of us. And that's when our dreaming occurs.
Why are we paralyzed, Elise? Do you remember?
I believe the brain releases glycine,
That's
which paralyzes our muscles.
That's correct. Isn't that amazing?
That is amazing.
Isn't that amazing that even when we're dreaming, our body is protecting us? Our brain is protecting our body from acting out these dreams. And have you ever met somebody that thrashes around in their sleep, that screams something? Let's say night terrors.
Yeah.
Who experiences night terrors?
Children tend to experience night terrors. And a lot of times it occurs when they are still asleep when they're having this night terror, and the parent can go in and make sure they're okay, but a lot of times they get through it and outgrow it.
Right, and actually in night terrors, at least the children can have their eyes open.
Okay.
Then their parents can be with them and they may not recognize them.
Oh, really?
Yes, when they're having these night terrors. So the idea is that dreams do mean something, and again, Dr. Freud suggested that the dreams were a window into the subconscious. Everything that we do, I met Brooke quite a while ago. There was a physician assistant student here, and she was telling me that she was tired. I mean, she was falling asleep at her desk, and I was asking her what was going on. She was telling me about these horrible dreams she was having at night, and not being able to sleep, and having night terrors and these things. So what we did, we went through some sleep hygiene throughout the evening, and she watched a lot of television. And what she did was she watched these murder ID shows and these things, and then she watched the news. Okay? And so what we did, we worked on some sleep hygiene and eliminating these things slowly from her evening routine, and eventually she started to have some good sleep. Imagine that.
Yeah.
Imagine
I'm sure
that.
that's a common problem.
Well, sure it is,
Yeah.
sure. So, and again, what we want to do is we want to look at the whole picture. They're having these dreams, we want to look at that, where are they coming from? And again, we remember these dreams are processing events. These dreams are processing events. And what we want to do, Elise, is we want to compare the emotions and the feelings that we're having in these dreams with your waking emotions and waking dreams. Because quite often, do you ever have a dream diary?
No.
Okay. Well, what I would suggest to you two, and I want to know every single detail. So when you put these notebooks beside your bed, and when you wake up, most dreams you start to, even when you remember the dreams, you start to forget them 5 minutes after you wake up. Okay. So I suggest that you start to write these down and get a little bit of a window, a little bit of a subconscious into your soul.
It's a good idea.
So we're going to be any closing thoughts today, Elise?
Yeah, well, we actually did look up. One other interesting fact is that dreams are free therapy.
But you can only get an appointment at night.
You can only get an appointment at night. That's excellent. That sounds like here. Well, we'll hope that everyone enjoyed, and we hope that everyone has pleasant dreams. Did you ever say to someone at night, at the least, to say pleasant dreams, good night, and pleasant dreams?
Yes.
You ever say good night and pleasant dreams?
Yeah.
That's a wonderful thought, and I would keep that as your intention. So when in the evening, I would suggest that you examine your sleep hygiene. We do not recommend the news to anyone, and actually television has no useful purpose. So we would suggest that you perhaps unplug your television. And again, we're going to close out today, and Miss Elise will do that for us.
Okay. Check out everything going on at Seclair with our health flyer. Download the PDF.
Oh, that's the wrong one.
Yeah. Just a second.
So, as usual, you can follow us on Facebook and Twitter, and go ahead and post comments and other things along those lines. You can also follow us on Google Chat or the YouTube videos that we post after this. So please go ahead and continue to follow us and make comments and remarks as necessary.
Absolutely, and we certainly, that was excellent. And we certainly enjoy you coming here. And as usual, we'll offer with our free prescription, which would be fruit, nuts, and vegetables. Perhaps unplug your television and take up fishing. And for a truly mindful experience, what would we do?
Try fishing without bait.
We would fish without bait. No expectations. Until the next time, our hope is that you be good to yourself. Namaste.